The Filipino American Cancer Care now brings you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.
Good evening, ladies and gentlemen. Magandang gabi sa inyong lahat dito sa Amerika. Good morning, Philippines. Magandang umaga, Pilipinas. Welcome on our radio show, On the Air with FACC, Filipino American Cancer Care. Of course, my name is Josie Moralidad Zayman, President and founder of the Filipino American Cancer Care. Now, before I introduce our special guest tonight, we would like to acknowledge on our radio show, of course, our station manager in Las Vegas, PHLV Radio. Our station manager, Johan. Thank you so much, Johan, for being with us dito sa radio show On the Air with FACC. And I'm just gonna take this opportunity. Excuse me. We have some upcoming events, fundraising event for the Filipino American Cancer Care. As you know, most of our funds, we try to apply for a grant, but we try to apply, but then wala pa, So we're still doing all these fundraising events. And our next fundraising event, ito yung Rio Brothers concert in Maryland, which is going to be on June 29, 5 p.m. in Bethesda, Maryland. And last 2 years ago, remember that? 2 years ago, we hosted the Rio Brothers. Sila yung kumakanta ng mga kanta ng Beatles and Bee Gees. And they're a group of talented siblings, brothers from the Philippines, are known worldwide for their outstanding covers of the Beatles, Bee Gees, and other rock legends. So we are going to be one of the beneficiaries from this concert, and you can purchase your ticket from the Filipino American Cancer Care. We have 55, 85, and 155. Call us at 571-352-0165. And on July 26, okay? July 26, we are going to have the Summer Fun event for the Filipino American Cancer Care. It's free for everyone. I'm looking for the covers, the information. Get ready and dance, support a good cause, and celebrate America's 250th birthday, because we are collaborating with Pinay Kitchen, and we are inviting everyone to a great day of tropical fun, Zumba, bingo, hula party, and mini concert. A free summer event full of energy. Zumba, bingo, hula dance, and mini concert, okay? We are going to celebrate the 250th anniversary of the founding of the United States of America. Saturday, July 26, 2025, 11 o'clock a.m. to 3 o'clock p.m. Free for everyone. And then August 9, okay? August 9, Saturday, we are going to have a cooking class with French Master Chef Evelyn Bunuan. And that's $50, We're going to learn how to cook some fresh lumpia, the wrapper for the fresh lumpia. It's not the shumai, or what's that? The shumai, right? Shumai. But this one, courtesy of French Master Chef Evelyn Bunuan, who is one of our board of advisors. And then, we have at the same time main dish, a side dish, dessert, and we are going to sit down in a long table. We're going to have a lovely lunch, 25 people are going to be part of this cooking class with French Master Chef Evelyn Bunuan, and our beneficiary, she has stage 3 ovarian cancer, and She was a former doctor in the Philippines, now working here in Virginia. But right now, she's not working. She has a son who's 19 years old and has autism. So she really needs some help. We will give her $1,000 from the cooking class. Okay? So if you want to attend, please call us 571-352-0165. All right, we have so many things to do and so many informations. It's a lot of work. We're not even paid here. Again, we are all volunteers at the Filipino American Cancer Care. And don't forget our 5th anniversary celebration, which is going to be on October 2025, Sunday, 3 p.m. at Hyatt Regency in Reston, Virginia. We are going to have 150 community models, survivors, and warriors, cancer warriors, and caregivers and families who are going to be walking on the runway. And we will have buffet. It's not just Filipino food. It's not just American, but Hyatt Regency is so they're so gracious to support the Filipino American Cancer Care. Ticket is $150 with dinner and dance, and it's a charity gala. All right. Now, let's go and introduce. I would like to take again this opportunity to thank our special guest. Nagkakilala kaming dalawa sa health fair ng Inova. As you know, we have this partnership with Inova Hospital. And she is one of the workers from the Inova. She is the research manager for trauma and acute care surgery at Inova Health. The study that she would be speaking about is called Boost 3, BOOST-3, which is comparing two different strategies for monitoring and treating patients with severe traumatic brain injury in the intensive care unit. All right? But they have not started the study yet. They are in the process of gathering feedbacks from the community. Ladies and gentlemen, please welcome on our radio show on the air with FACC, Laura Madarász. She is also she's Filipino American. Okay. I'm not sure if we can present, we can show the present these slides, because if I'm going to do that, Laura, I'm going to lose the recording. I hope you understand my point.
Okay, no worries. We can just speak.
All right. So, welcome to the Filipino American Cancer Care. We are so glad to have you, and you're Filipino American. Tell us about your background first.
Sure. So I grew up in Houston, Texas. I moved up to the Virginia, Maryland, DC area after high school. My mom is Filipina. She's from Manila, and she came to the U.S. as an exchange student, and she had met my father. They were high school sweethearts. So that's how she came here. That's a bit of my background.
Mm-hmm. Have you been back in the Philippines?
Yes. Yeah, I have been 4 times. The most recent time was, I believe, in 2010. So it has been some time. Yes.
So you understand a little bit of Filipino?
A little bit. I'm not fluent, but a little bit.
But both are your parents, are they Filipinos?
No, my dad's American. My mom.
Okay. What is the hometown of your mom in the Philippines? Where in the
Manila.
Philippines? Oh, Manila. Okay. Now, growing up, with a Filipina mother, of course, in a Filipino American household, was there a moment or experience, that made you want to go into healthcare or research when you were growing up? Because every Filipina mother, you know what? They would like their kid to be a nurse, to be a doctor. You know, Jokoy?
Sure. As- um, so many of my family members are involved with healthcare in one way or another. I'm sure it is very common. But I definitely have multiple aunts and uncles who are physicians. Some of them have immigrated here to the U.S. and they went and did their residency again and got certified, so they are practicing here in the U.S. and others are involved in other healthcare careers. And even in my immediate family, most people are involved in healthcare one way or another. Not all clinical. I have family members who are involved in healthcare administration, IT services. Also, my husband's a clinic manager as well. So we're all involved in healthcare in different ways. So
Mm-hmm.
I've kind of like always been um, exposed to it. And something that's interesting about my background is like I initially was really drawn to research because when I was growing up, um, in like the 90s, that is when the Human Genome Project was brand new. We had just sequenced the human genome, and all of that was just so fascinating to me. I wanted to go into research. But then I found when I was in college, I I took a class on the American healthcare system, and I kind of became aware of the issues of healthcare access and how that is a major challenge about how we have like all these even though we have the most cutting edge medical technologies in the world, in the US, it is still unfortunately inaccessible for a lot of people. And that's kind of what kind of uh, made me look more into healthcare. But I ended up coming back into research.
So you're a
And
scientist. You're a
so I'm
scientist.
a clinical researcher. So it's the type of research that we do at Inova Health is really focused on research that is going to have an impact on patients in the near term, as opposed to more like basic science type research. So that is really what I focus on is and I lead the team that is involved with actually recruiting patients and enrolling patients into research studies and then conducting the studies that collect the data.
How long have you been working with Inova Health?
Sure. So I have been working in research with Inova for 9 years now, since 2016. I previously worked with Inova in various registration technician roles for 3 years prior to that. And then I went away for school and came back in 2016. So altogether, it's been over a decade.
Wow. Okay, let's talk about Boost. You know, sometimes I have that accent, BOOST dash 3, Boost 3, right? Now, what is Boost 3? And could you explain the main goals of the Boost 3 study and what makes it different from previous research in the field of TBI or traumatic brain injury?
Sure. So Boost 3, it is a study that is organized by the National Institutes of Health. This is, so there are about 45 hospitals across the country that are already participating in this study, and Inova is looking to join this research effort as well. And so first explain what exactly is TBI, traumatic brain injury. So this is when you're hit in the head very hard, enough to cause a severe injury. Important distinction. This is different from, say, a stroke. So a stroke is also a brain injury, but that is not caused by being hit in the head. So this is like a car crash, a fall, something like that.
Mhm.
TBI is the leading cause of death in children and adults age 1 to 44, and it can result in severe disability or even death. So it's a serious issue. And what Boost 3 is doing is it's comparing two strategies for treating traumatic brain injury in the intensive care unit. So it's comparing two different monitoring strategies. And this study, we are looking to include anyone who's 14 or older with a severe brain injury. So this is not going to include concussion. You may have known someone who's had like a mild form of brain injury. So this is only the most severe injury where someone is basically in a coma. We're not going to be including women who are pregnant, prisoners, or other people who are in a vulnerable state, or people who are wearing a medical alert bracelet that says that they want to opt out of the study. And so how it will work is when patients come into our hospital through the emergency department, if they meet the criteria, they will be randomly assigned. It's like flipping a coin to one of two groups. So one group will be placed on a brain monitor that is measuring intracranial pressure. The other will be on a monitor that is measuring both intracranial pressure in the brain plus oxygenation in the brain. And so, and then the doctors will treat the patient based off of the information that they get from these two monitors. So that's the difference between the treatments. As far as risks, the risks of being on brain monitors are you could experience pneumonia, lung injury, infection, or bleeding from the brain probe. So it's important to remember that those risks would be there even outside of the study, because even outside of the study, if you have being treated for severe brain injury, doctors will need some type of monitor anyway. But as far as risks that are specifically related to the research participation, there's a potential for confidentiality breach or pain or bruising from blood draws. But we take every step to protect patient privacy. We de-identify the data that is collected and keep everything very secure. As far as possible benefits for the study, we think that the patients who would be receiving the monitor that measures oxygen information as well as the pressure may benefit and may have improved outcomes. And in addition, there's a potential that we may benefit patients in the future who get traumatic brain injury if the knowledge that's gained from the study helps doctors treat patients better.
Okay, so your study, Boost 3, looks at how we care for patients with serious brain injuries, right? Now, can this research also help patients with brain cancer since they may face similar problems in the brain?
So cancer is it is different. So cancer is not like a severe sudden brain injury. So that's kind of the difference between trauma and cancer. Cancer is something that kind of develops over a long period of time versus trauma is like a really sudden injury. So the mechanisms for treating that are very different. I do have experience with brain cancers. And I've done other studies in that area, but this really is distinct. But of course, everybody is at risk for getting an injury. So it definitely could affect the listeners of this show as well.
Okay, we're going to talk more about that study.
Sure.
Now, again, I just wanted to ask you some questions related to cancer before we explain more about the Boost 3. Some cancer patients, they have emergencies like bleeding or swelling in the brain. Can the monitoring tools, for example, can they be used in Boost 3? Can these monitoring tools used in Boost 3 help doctors respond better in those cases?
I don't believe that it is used for that. That is not my area of expertise. So I would definitely refer that question to our principal investigator, is Dr. Ramani Balu. But yeah, I don't believe that it has that application.
And another question. Do the strategies you're studying in Boost 3 help improve how we understand the brain? And could that be helpful later, in other cancer research or treatments?
Yeah, so basically the way that it would help us understand the brain is knowing whether that oxygen information is helpful for doctors for treating patients. Because right now at Inova we typically only look at the pressure information, the intercerebral pressure,
Mm-hmm.
and we don't know if this additional information helps doctors to treat the patients better and lead to a better outcome. So that's really
Mm-hmm.
what we're trying to find out.
Okay. Now, how will be the findings from this, study? Potentially, like, how will it impact the clinical practices? Like, for example, in the intensive care unit for
Mhm.
patients with severe injuries or traumatic brain injury.
So it has the potential to change our standard of care practices. So the brain monitors that are being studied are monitors that are already FDA approved and available for use. But doctors don't know which one is really better. They've never been formally compared against each other in a
Mhm.
controlled, randomized controlled trial. So that's really the purpose of the study is to tell which one of these two strategies works better.
And tonight, kasama natin yung ating isa sa mga sa mga board of directors. I get so confused because I have two radio shows, one in the Philippines and one here in America, and there are so many things that we had to do or we have to do. But anyhow, we would like to welcome again our Executive Vice President for Filipino American Cancer Care and our Board of Director, Ivy Prey. Hi, Ivy.
Hi everybody. How are you?
And you remember Laura from Inova Health.
Mhm. Yes,
Okay.
I do. Hi, Laura.
Well,
Okay. So, Ivy, we have been talking about, recruiting patients and data collection, the challenge, uh, in terms of gathering feedbacks from them. Like, for example, what kind of feedbacks, Laura, are you hoping to gather from our community? And how will it influence the final design or the approach in terms of this study?
So the question that we have is, do people think it's okay? So if you were to get into a car accident and it was really severe and you came into the ER, we enrolled you into this study before you had a chance to have a consent conversation, or or if you had a teenager who had like a sports injury that was really severe and they came into the ER and we enrolled them into the study even before we had a chance to talk to the parents about it. We want to know, do people think that is okay? Are you comfortable with this kind of thing? So the FDA does have a set of rules that allows for this consent exception only in the case of emergency research where there's a condition that is life-threatening. The existing treatments are unproven. The study might benefit the participants, and getting permission ahead of time is just not possible because we can't predict who will get an injury and the timing of when we would need to start treatment is it's a very short window. So only in that very specific instance, FDA says that we can have a consent exception, but only if the community finds it acceptable. So that's what we want to hear from people about.
Mm-hmm. How do you envision your collaboration with other medical centers or researchers with this study?
Sure. So there is a network of hospitals across the country that are contributing
Yeah, you
data
mentioned
for
that
this.
before. Mm-hmm.
So this is being organized with the National Institutes of Health and the University of Michigan. So all the data is going to be gathered together, and that's going to form what the new standard recommendations for patient care.
Mm-hmm. Ivy?
Yes.
Okay, do you have questions for Laura?
So my question will be, you said including teenagers who are driving. So this would include minors, right?
Yes, age
So
14 and up. Mhm.
14 and up. Okay. Um, would that, so what about minors who are involved in traumatic incidences before the age of 14? So let's say if this minor was, excuse me, let's just say this minor was in the car with the driver.
Mhm.
Will this cover them if they're under the age of 14?
No, so it would not include under the age of 14, and this is only for acute injury. So we're not looking at people who've had a brain injury in the past. This is only for people who just had a brain injury. And so the study is really only um, on what treatment they will be receiving when they're in the intensive care unit at the hospital. So it's only about the monitoring that they would receive in the hospital, not after that.
Mhm.
Okay.
How will you address any ethical concerns, related to studying patients with severe TBI or traumatic brain injury? Like, for example, again, in the ICU setting, especially when they may be unable to provide consent.
So we do have what's called an institutional review board. So this is an ethics board that does take all of this information into consideration. And they're also going to be looking at the feedback that we receive from this consultation. They will take that into consideration. And we also are bound by the ethical research standards that are in place to protect the rights of human subjects.
Mm-hmm. Ivy?
Okay, I was just thinking. Okay. Um, how, okay, so this is for any patient that enters the ICU above the age of 14. They cannot have any no prior brain injuries. This would be their very first diagnosis of brain injury.
I can't remember all the exclusions, but I believe, yes, they could not have had a prior severe brain injury.
Okay.
This is one of the exclusions.
Yeah. I think actually I think that in the moment when injuries like these happen and you can't get a consent right away, I do think that it's important to know beforehand. I mean, to me, I guess it wouldn't be any different than your driver's license saying I'm an organ donor.
Hmm.
Do you know what I mean? It's almost like I know it's a completely different level of consent, but if you're consenting to be an organ donor, um, you
And so that's a little bit different because that's like an
yeah.
opt-in system. So this study does have an opt-out mechanism. So if someone were to let us know, they can send us a request along with their mailing address, we can mail them a medical alert bracelet that says boost 3 opt out. And so if they come in in the ambulance and they're wearing that medical bracelet, then we would know not to include them in the study. So there is that option if people want to request it.
Mm-hmm.
Okay, so the bracelet would say boost 3 opt out, which means they do not want to be treated or they do want to be treated.
That means that they do not want to be included in the study. So they would.
Follow-up question. Why did you choose the age of 14 as a focus developmentally, in this study?
So my team is not part of the team that actually made the design decisions. But my understanding is that teenagers are basically they're physically developed almost as much as an adult body is. So that's why they're included in this study. I mean, we do recognize that they are still kind of a vulnerable group since they are still minors. But physically, because they are kind of developed, that's the reason why they are included in the study.
Mhm. Are there ethical considerations? Did you weigh when deciding to include adolescents like 14 years old, in your research?
That is like one thing that we want to ask people about. If people believe that teenagers should not be included, that is something that we could recommend to keep it to 18 and up. Our institutional review board will take that feedback into consideration.
Okay. Ivy?
I actually think this is a pretty good study, a very good program. And basically, you're just checking to get consent before a traumatic event occurs. I do think that it's important that people realize that and then come to light when it comes to making these kinds of decisions. I mean, reality is we actually live in an area where this can happen almost any time. And even with minors as young as 14, they're not always with their parents when these things happen. They could be with
Friends.
family,
Mhm.
or even a sibling who could be driving um, so I I do like this study because it's important that people really do realize this. And I know that being in the medical field, time matters, and sometimes you only have a certain amount of time to treat something. You have a certain amount of time. You only have like this window of time to administer a medication. Once you've passed that window of time, you're no longer eligible for that kind of treatment. We have to look at other avenues, you
Mhm.
know? I mean, let's just look at stroke medicine, um, for an example, right? You have someone experiencing stroke, um, or any cardiac issues. You have what, 6 hours, right? From the time the onset of the onset of symptoms occur to get treated.
Mhm. You
There's
are
certain
fighting for the time and life of a
Mhm.
patient.
And so waiting for a consent, looking for that 14-year-old's parent, right? And let's be honest, you know, most parents, say, "Oh, hey, you want to bring your friend? Let's bring your friend." But I guarantee you that that parent that's assuming of that friend to come hang out with them or go to a game or go on a vacation may not necessarily have that other friend's parents' contact information. So I do think that is, I mean, erring on the side of safety, I do think that that's important. So I've had the opportunity to talk with you at the Inova Health Fair, because you were at the table next to us and had the opportunity to look at some of those questions. I do think that that's important.
Thank
Um,
you.
mhm. You're welcome.
So how do you make sure again, that informed assent and parental consent?
Sure. So, if the family is present there, if they arrive with the patient, then of course we would ask them for permission right then. But if no family is present at the time, and the patient needs to start the treatment, then we would go ahead and start it. But we would keep trying to reach out and identify family. And then as soon as we're able to get in touch then we would have a full consent discussion with them. So they can later let us know if they're not comfortable with it and they want to stop the study. So that's how we handle it for this.
Okay. How about, like for example, how do you account for differences in socioeconomic background, the race and the gender when you are including youth with TBI?
So there, again, I'm not part of the team that does the analysis, but I do understand that they do collect that data on age, race, and gender. So they will make sure to. I'm not sure if they'll do like a subgroup analysis to kind of compare those differences. But we are also hoping to enroll a representative sample of our diverse community. And that's kind of another reason why we have to have this consent exception. It's one of the ways that we are able to, as best we can, get that representative sample of data so that everyone is being represented in the data set.
Mm-hmm. Ivy?
No, I think so I may have missed this earlier, but let's just say someone ends up with a traumatic brain injury and they end up in the emergency room. What's the process of finding out whether they're in the Boost 3 program or not? And then does someone try to get consent right then and there, or?
Yes, so our clinical teams are all aware of the study that is going on. So they will screen the patients for the eligibility criteria, which is, I mean, the major criteria are 14 up and having a severe enough brain injury. And if that is the case, then we will try to find family. And if we are unable to, then we would proceed with the study, but continue to try contacting family. We do have case managers who even outside of research, we always want to try to find the next of kin in these emergency situations. So they will try to locate family as soon as possible, because that is important for medical decision making.
Okay,
Okay,
wonderful.
so
Wonderful.
what are the benefits, for example, for the, a patient and of course to the family? Because some studies, they give some incentives to the participants.
So there are no like financial incentives for participating. So and there's also no cost. So it's not going to add to anybody's medical bill. But there's no like reimbursement. But we do think, just based off of prior studies, that brain oxygenation may actually help patients in their recovery. So the patients who are randomized to the arm that gets the dual monitor have a potential for having a better outcome. And then, but the main benefit is really that we'll gain knowledge from the study that will help doctors to treat patients with traumatic brain injury for the future.
Mm-hmm. To save everyone. Now, do you have any strategies for including youth with more severe impairments, who are often excluded, of course, from the research?
So for this, it would be anybody who arrives at our hospital who meets the criteria would be included as long as they don't have any of the study exclusions. So that does help with our reach. So Inova Fairfax is a level 1 trauma center. It's the only level 1 trauma center in the area. So pretty much anyone with a severe brain injury would be coming to our hospital.
Mm-hmm. I'm just curious, of course, you have been doing this as a researcher and having that Filipino background, and growing up with a Filipina mother. What advice do you have for, young Filipino Americans who, of course, wanted to become a researcher? And of course, there are parents, Filipino parents, especially in terms of studies, sometimes they are hesitant to have their child be part of any studies.
Sorry, I didn't understand. Were you
How
asking
do you
about like
motivate?
career-wise or?
Yes, how do you motivate a Filipino parent, for example, to to be part of this study, to be included in this study? Because as you know, in our culture, we're very reserved.
Oh, sure. So, something that's very important to know is that there are very strict regulations in place to protect the rights of participants. It is true that in decades past, there were instances of misconduct and ethical issues. But the community has worked really hard to put into place standards to really protect patient rights. And all that information is included in the informed consent document that we do go over with the family as soon as we are able to get in touch with family. So they know about how their rights are protected and who to contact if they have any concerns or if they want their loved one to be taken out of the study. All the information is there.
So how do you think we can help the Filipino American community learn more about brain injuries and trauma care?
Sure. I did leave a link to our website where you can learn more about this.
Do you
I
have
think that would
like
be
a
a good place.
direct line? Do you have like a direct line?
Yeah, I can share my email and phone number.
Mm-hmm. Can you say it again, the website, by the way?
Sure. So the website is Boost, BOOST, and then the number 3, trial, TRIAL.org.
Mm-hmm.
And then we also have a website if anyone wants to take a survey to give their opinion about the research. So the website is http:/bit.ly/boost3 community survey. And they can also email feedback to surgery.research@inova.org. So that's surgery.research@inova.org.
Mm-hmm. In your own opinion, how has the treatment of brain injuries and trauma changed over the years?
So that's a better question for a doctor. So I am more involved with the
Analysis.
research.
Mm-hmm.
Yes.
Okay.
Mhm.
Ivy?
So I'm just going to look this up real quick.
Sure.
I'm going to look at boosttrial3.org. I'm sorry, Boost 3 trial.
I'm really curious about the word Boost 3. Right now, I have this freestyle. How do you call that? Libre or Liber 3. I don't know
Oh, the
what's with
Libre
that.
3?
Yeah, I don't know what's with that 3. When I was working in the Philippines as a radio reporter, my number is 3. Now this one is
Oh,
Boost 3.
so it stands for, so this is like the third phase of this study. So there have been this is they've tried different study designs before to kind of form the basis of this. So that's what the number 3 means. And what BOOST stands for is for brain oxygen optimization in severe traumatic brain injury.
Can you say it slowly? Brain
oxygen optimization in
brain
severe
oxygen
traumatic brain injury.
optimization. Did I say it right? And then S stands for what?
Is severe, and
Traumatic.
then C is for traumatic brain injury. Yeah.
Oh, okay. Now we know, because 14 years old might, might be asking us that, what are you talking about? Boost 3.
So what states are participating in the Boost 3 trials?
Sure. It is across the country. I believe if you go on that boost3trial.org, it has a map of all the participating hospitals, but it is across the country.
Mm-hmm.
Okay, so everywhere. Okay.
But
Because
this is
when I
only
pull
in
it up,
United
it pulls
States,
up-
right? It's only in United
Yes,
States.
it's in the United States.
Yeah. But in the Philippines.
Okay, because when I pull it up, it pulls up like, oh, yeah, actually that would be really important.
Yeah, in the Philippines, because there are so many
It pulls up,
TBIs.
yeah. I pull up Stanford, I pull up Michigan, I pull up Maine, I pull up Ohio, Florida, Chicago. So I don't see anything on the West Coast, but I'm sure it's there. I didn't pull up that map. But I was just I think this is a really good this is a really good program. This is a very good study actually.
Mm-hmm.
Because I do think that so now
I'm actually very interested
you
with this study. You know what I'm saying, Ivy?
Yeah.
There are so many
Yeah.
studies in our, organization. Some universities, some research, they reach out to FACC about cancer research, about this, about that. But the more you talk about traumatic brain injury, actually everybody can benefit.
Yeah.
With this study.
Right, because everybody is at risk. Mm-hmm.
So where do you see this study going? So let's just say it's approved, right? And the community, the United States community approves of it. What happens next?
So then we'll open up the study for enrollment, and we will try to I can't remember what the recruitment goal is, but it's several hundred patients that they're trying to enroll across the country. And then once enough data is collected, they will look at the results, and that will help inform what treatment strategies are recommended for going forward for treating this condition.
Okay. Now, will it be something like, and I keep bringing the organ donor because I feel like that's the only one that I am aware of. So when you say 14-year-olds, so 14-year-olds are allowed to have like state IDs, right?
Mm-hmm.
So will this be identified on the state ID? Will there be a section on there that says Boost 3 inclusive or Boost 3 opt out? So will it be like, are you an organ donor? Yes or no? Like, are you a Boost 3?
No, so this is not a study where people have to indicate that they're opting into it.
Okay.
But if they want to opt out, they would have to request the medical alert bracelet that we would send them.
Okay.
So if someone wants to opt out, they can send the request along with their mailing address to that email that I said, the surgery.research@inova.org, and we would send that to them. But then they would have to like like wear it all the time in case
Okay.
of an emergency, at least for like the next couple of years while the study is going on.
Okay. So yeah, so everyone then at that point is pretty much automatically enrolled in the Boost 3 process unless you say, I do not want to be part of it. And you're basically wanting to know if getting consent for it is helpful.
We're wanting to know if people feel comfortable with having this exception from consent. So we would not be able to get consent ahead of time before starting the patients on this monitoring strategy. We would only be able to follow up with family after the fact.
Okay.
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 So we have 2 minutes on our radio show. Maybe you have some more information that you would like to share to our viewers and listeners, to anybody that's watching us right now.
I think that about sums it up. Yeah, so we really would like your feedback, either positive or negative. We want to hear everything. And yeah, we just want to make sure that this reaches everyone. And if anyone wants to invite us to kind of speak with another local group they think might want to hear about this or give us our feedback, we're doing several events like this to get the word out. So please feel free to contact us if you would like to do that.
Oh, so you also do these community events in order to disseminate the information.
Yes.
Ivy, they should attend our charity gala, right? They can have
I was just thinking that I think that would be a good idea. And even if you had like even if you had like a booth there, right? I think that would be a good idea because you might even be able to capture a lot of people there.
Yeah, that might be, a good thing for Inova as well to see the event and be connected again with diverse group of people in the community.
Agree.
Thank you so much, Laura, for sharing your time with us. I know we are talking serious matter here because this is about brain injury. And sometimes we talk a lot about, winning the fight against cancer. And if they want to contact you, where should they contact you? Can they email you? Can they call you? Or would you like to share some contact information?
Sure. So the best email is surgery.research@inova.org. Or my phone number is 703-776-2189.
Thank you so much, Laura and Ivy, for being with us on PHLV Radio, on the air with FACC, Filipino American Cancer Care. Bye.
The Filipino American Cancer Care has just brought you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.